Okay. Hello, everybody. My name is Jenny Smith, and I am the Events Engagement and Communications Manager for the Trinity Challenge, and I've been leading on youth engagement work for the team for the last year and a half. And so far, we've run 2 Trinity Challenge Youth Summit and competitions, and this is our third. And we're very excited to welcome you and to get started with the event today. So thank you so much for joining us wherever you are in the world. I will just give a quick overview, so some housekeeping, and then the agenda and what we are planning to do today. So feel free to use the chat function so you can tell us where you are, where you're from, and what your experience is, what your interest is in terms of AMR, or what research project you're in, or what charity you work for. You can also use the Q&A function if you want to submit a question. And sorry. Just to let you know that the majority of this session will be an interactive workshop, and we really want you to engage with the facilitators and the scribes that we've got in the rooms that are helping out today. So if you can put your camera on and if you can unmute yourself during those sessions, we would really appreciate that, and try and be in a quiet location so that you can interact in a really meaningful way. So before we get started with a sort of explanation of the Youth Summit and what we're trying to achieve by doing this, we've got a short message from the chair and founder of the Trinity Challenge, who is Dame Sally Davies, who is the UK envoy for AMR for the British government, and has held a lot of roles in the past with regards to public health in England.
Hello, everyone, and a very warm welcome to the Trinity Challenge Youth Summit. It's a very real pleasure to welcome you to this.
I feel like that wasn't giving us the quality that we want, so I'm going to share the video by itself.
Hello, everyone, and a very warm welcome to the Trinity Challenge Youth Summit. It's a very real pleasure to welcome you to this, our third Youth Summit, and to see so many young leaders joining from across the world, ready to share ideas, challenge assumptions, and shape solutions. At the Trinity Challenge, we believe that collaboration across generations and across sectors is essential to tackling the greatest health threats of our time. So, of course, it's vital in mitigating the antibiotic emergency. And that's why youth engagement is at the heart of all our work. And we have already seen the power of this approach. In our first youth competition on WASH in schools, we saw young innovators create practical, scalable solutions to improve hygiene and reduce the risk of infection among school children and their local communities. In our second competition, which focused on biosecurity and animal health, youth teams brought forward bold and impressively creative ways to improve biosecurity on small-scale farms, protecting livelihoods as well as animals and our health. These initiatives didn't just generate ideas, they created real momentum, real learning, and very real impact. Our new impact video, which I hope you've seen, shows how far these projects have travelled, and I encourage you to take a look if you haven't. This year, for our third challenge, we're turning to a theme that cuts across every element of the One Health approach. We're calling it education or educating for behaviour change, because often it's the small changes in our daily lives, such as washing our hands to prevent infection, completing the prescribed or appropriate course of medicine, better management of waste, caring for our environment that can make the big differences. Behaviour change, I can tell you, is not easy, but it is powerful. Behaviour change can save lives, protect communities, and behaviour change ensures that scientific progress is supported by human action. And we believe young people are uniquely placed to drive it forward. You, young people, are the trusted voices in your families, your schools and communities. You, young people, understand how to reach people where they are. And you, young people, you inspire them to act. So we begin this summit and competition. And as we do so, I want to encourage you to think outside the box, to think differently, to target new audiences, and above all, identify new local solutions for your local problems. Our world is really in need of fresh ideas and new energy, and I know you can provide it. Thank you for being here. Thank you for joining in. And as well, thank you for the leadership you're already showing.
Okay, so that was a message from Dame Sally Davies, who, like I say, is incredibly supportive of youth engagement work and has really encouraged the Trinity Challenge to continue to work on these different projects. So let me just go back to the slides. So first of all, I'm going to talk a little bit about why this topic is important. So we know we look across the whole One Health spectrum at this, as Dame Sally said, and we're going to do a little introduction to the different topic areas and talk about why AMR, One Health, and behaviour change are all really important. So, as I'm sure many of you know who are already here, I'm sure you're already working in AMR and One Health. So as we know, it's the antimicrobial resistance, or AMR, which occurs when bacteria and viruses, fungi, parasites no longer respond to antimicrobial medicines. And AMR, which is this One Health issue, and it shows an increasing threat to our health, food, and environmental security across human health, animal health, environmental health. So some of the reasons why it's so vital that we act now and so important that we engage young people in this process, because really your generation will feel this the most. Obviously, there's the health threat that we see, AMR threatening regular medical procedures, so surgery, cancer care, things like giving birth. If you have to have an operation during that process, then that will become incredibly risky. There's also issues of food security, so antibiotic misuse or overuse can reduce food production, increase costs, and threaten livelihoods. There is the environmental factors, so pollution from antibiotics. We know that a lot of our rivers and lakes and the ocean are all being polluted by different individuals, companies, factors, and so that can cause really serious problems to our environment. And then there's geopolitical security. So AMR could push 24 million people into extreme poverty by 2030, causing major economic, social, and geopolitical disruption. So all of these different factors, whichever topic you want to look at, one of these or more of these will impact the topic that you're going to discuss today. So just keep those things in mind when you're thinking about the behavior change that you want to implement and how you're going to do that. So like we said, it's an AMR, educating for behavior change within the AMR space is really vital, because so many of today's greatest health threats are not just fueled by science, not just fueled by policy gaps, but also fueled by everyday action that take place in our communities with us. So even if we have the best science, the best medicine, the best advancements, people still need to understand that we all have a responsibility in making sure that they work properly and they work for everybody. And so understanding what that looks like within the One Health environment is really, really important. And we know that young people across the world are already pushing for lots of different kinds of behavior change and involved in these powerful shifts. I mean, you can look at the environment movement as an example of that, when young people got involved through Fridays for Future and other different methods as well. But that was a really powerful thing where young people uh, pushed uh, pushed for change within their communities with regards to the environment. So I'll give a little youth summit overview. So like we said, we're looking at the One Health environment today. So we've selected these 6 different campaign topics. And I know that you all, when you registered for this, you selected one of these to be the one that you wanted to look at. The most popular by far was community health, and we know that a lot of you already work in community health. But I really encourage you that if you have like a secondary interest, or if there's another one of these topic areas that you could look at, please go into one of those rather than going into community health, because we think community health will be quite busy anyway. So we're going to offer 2 different rooms with community health, but we would really love it if the other ones had enough people in to make sure that the discussion can carry on. So if any of these has a secondary interest for you, please go into your secondary interest rather than going into community health. I'm just going to run through and give a brief explanation of each of these topics so that we can make sure that you understand what you're getting yourself in for. So obviously, livestock animals. Our second youth summit, really, a lot of the campaigns there focused on livestock animals and how AMR and biosecurity can impact that. But antibiotics are often used not only to prevent and treat infection, but to promote growth in animal food. And this overuse can really lead to resistant bacteria that spreads through animals. If you're interested in livestock animals, if you're interested in, protecting livelihoods, small scale farmers, then please go into this one. We've actually combined livestock animals with companion animals because we only had a few people select companion animals. So I'll just explain about the companion animals, which I know if you are all following WOA, or if you're following the Food and Agriculture Organization, a lot of them have recently updated their guidelines to include more information on companion animals. So obviously our pets, our companion animals, share our space, they share physical contact with people. And if they carry resistant bacteria, these can transfer quite easily to owners and communities. And so making sure that we don't have misuse of antibiotics or overprescription within that space as well is just as vital as with livestock animals or humans. So another really interesting topic. So livestock animals and companion animals have been joined together for this session. And if you're interested in either of those, please go into that workshop group. Food chain is another one that we'll be focusing on. So this is looking at the farm to fork, the process of how meat and different food gets to your table, and what is the situation with the presence of antibiotic resistance in that. A lot of meat, because of antibiotics going into our animals via feed or via medicine, it means that the food chain can also have a significant amount of antibiotics in. So if you're interested in food chain, please go into the food chain breakout room when we open the breakout rooms. Like I already touched on earlier, environment is another one. We want to look at how our environment, so the soil that we have, or rivers or lakes, how is that being affected by AMR and resistant bacteria? We know that a lot of farms are close to rivers for different reasons, and the runoff from the farms in terms of waste management, slurry, things like that, that can all mean that the local environment, the local communities are exposed to antibiotic resistance. So if you're interested in environment, which I'm really interested in environment, and we would love to see some really good campaigns come in around, the protect our rivers, protect our lakes and oceans. So if you've got an interest, primary or secondary, in the environment, I really encourage you to go into this session today, and have a think about what behavior changes we could implement in order to better protect our environment from AMR. So, as I mentioned, community health, this was the most popular topic that people chose. We know that a lot of people are working in the human health space and in community health. Obviously, AMR undermines the ability to treat infections in people, which, as I mentioned earlier, can really impact these routine and regular medical uh, conditions that we have and illnesses. So I know a lot of you are working in this space already, but like I said, we'd really encourage you to go into one of the different topics today um, if this is your main focus on a day-to-day basis. Okay, and the final one, which again, Trinity Challenge is really interested in this. So our previous director, Professor Mark Mendelsohn, was someone who looked at this. Our partners who are here today from Black Sands Communications also have looked at uh, the language of AMR and how do we communicate AMR, the problem of AMR, to the general public using clear and culturally sensitive language. So we know that in a lot of different places, how people approach antibiotics, how people use them is very different. So how do we make sure that we do it in a way that is relevant and appropriate for all of the places around the world? And how do we support local and global prevention strategies through better use of language? A really interesting topic. I really encourage you to go into that room if you have a bit of an interest in the language and how we communicate around AMR, because I think it's going to be a really interesting topic. So they're all the different topics that we've chosen, the different categories. And so just have a think about that. Like I said, we really want to make sure that there's enough people in each room to have a good discussion. So even if community health is your usual thing, but you have a little interest in something else, consider going into the other room when we open up the breakout sessions. I'm just going to do a quick introduction of the uh, two previous cohorts of winners that we've had. We're very lucky to have had such engaged and innovative groups that have that have attended these events before, applied for the funding and won the funding. Um, so the first competition was focused on WASH in schools, and the second competition was focused on biosecurity and animal health. And we've had winning teams from all around the world. So here you can just see a few of them: Nepal, India, Ecuador, Uganda. We had so many applications to the funding bid, and we've awarded over £100,000 now to 14 different winning teams. And we're really proud of this work, and we really think that the young people who are leading on it are making such an impact in their local communities. You can watch our impact video to get a little flavor of what they've been doing and see some of the families and the communities that they've been working with to better promote in cohort one's position, better wash practices. These are all the listed teams, the organizations that supported them, and the countries that they have been working in. There's lots more information about these teams on our website that you can see. And we actually have some of our winners here today supporting the facilitation and scribes of the breakout sessions. So I'm sure they will tell you a little bit about their experience. This is cohort two, working on biosecurity and animal health. Again, a different spread between Africa and Asia, but all very different organizations, all very different campaign teams, taking it from different angles. But like we say, incredibly innovative work, really working hard to spread the word about AMR and help people working on small scale farms protect themselves, protect their animals, and protect their livelihoods. Cohort 3, who will it be? So, as we say, today we're looking at educating for behaviour change. We want to think about what campaigns can work to identify a campaign, identify a behaviour change that we want to make within our own communities, and then what can we implement in order to get there? So maybe it could be you and your organisation. So talking a little bit about that, now I'm going to hand over to Rachel, who is from one of our partner organisations at Black Sands Communications, and she's going to talk to you a little bit about campaigning for behaviour change. So I'll hand over to you, Rachel, and let me know when you need me to move the slides on.
Thank you, Jenny. Hi, everyone. I'm Rachel Bloodworth from Black Sands Communications. We're a small consultancy working on communications and campaigns across climate, nature, development, and health. We're really excited about the focus of this Youth Summit on educating for behaviour change. Raising awareness on the issue of AMR and driving positive change requires audiences to engage. And people are much more engaged on an issue when they see the role that they can play in the change, a change that they can achieve in the world. It drives empowerment as well as positive impact. Behaviour change is complex and it takes time to drive sustained and scalable change, but it all starts somewhere. Today we're going to be talking you through a framework called EAST. If you could take me on, Jenny. So EAST stands for easy, attractive, social, and timely. And it's a way of helping you develop the structure of your campaign. If we go on to the first one, Jenny. Easy. Easy is all about creating an accessible way for audiences to make the change and take part. It requires simplified messaging, clear steps, and really importantly, the removal of barriers to action. An example of how this has been driven in a different sector has been when there was a challenge to increase people's ability to return their tax returns. And it was found that the response rates went up hugely when the forms were filled in as much as possible for the people taking part. So removing the barrier of filling out the whole form and making it easier to take part. So when you're in your group session, you're going to be working through these principles, and we encourage you to think about how to make it easy for people to create the change. On the next slide, we've got attractive. So this is about creating standout, highlighting the benefits to audiences of taking part, framing choices in a positive way. It requires strong design for campaign materials. And we also encourage you to think about incentives that could be created to encourage people to take part so that we really attract the attention of our audiences in a very busy world that we all live in. Next, we have social. And this is about showing that people like you are already taking the action so that it feels normal, not like you're doing something that needs to be different. So an example of this in a different sector again has been hotels and how they message for residents or people staying in the hotel to reuse their towels. Instead of giving them the reasons they should reuse their towels, they've created messaging to show how many other guests are already starting to make the right choice and reuse towels, which makes it seem much more normal, attractive, and easy to take part. So that's about how to really center the action in a way that helps people feel part of something bigger than themselves. And then lastly, the last principle is timely. And this is about choosing the moment that you ask for the change. And this can vary depending on time of the day, the week, the year, or the moment in someone's life. So really thinking about how best to ask for that change. An example on this has been when there's been a desire to reduce people not making it for their medical appointments in some parts of the world. And so what's been put in place there has been text messages to remind people when their appointment is. And when that text message is sent, and getting that timing right has a huge impact on driving that change so that people don't miss where they're meant to be. So hopefully that gives you a flavour of some of those principles. But it's also important, if you take us one more step, Jenny, to think about measurement for any behaviour change. This is going to be important to you when planning your proposals for the Trinity Challenge and also whilst activating your campaign. There's a lot of different measurement tools to consider. And the reason I flag this now is because it's going to be really important to have a benchmark and an understanding of where your audiences are starting in their behaviour change as to where they finish. And some of these things you would want to measure not only before and after, but even during a campaign for behaviour change. I will stop there and then just mention the group session. The agenda will take you through a quick reminder on those principles with your facilitator so you can ask any questions. And then you're going to explore 3 of the principles: easy, attractive, and social. We can't wait to see what you come up with. Actually, there might be a mention there on Miro. Is there to follow, Jenny?
Oh, yes.
The discussions are going to take part using a Miro board. So hopefully everyone will have access to the board. It's very easy to use. You can scroll in and out and along and all around the board separately from all the others that are using the board at the same time. If you do have any difficulty using the board, there's a scribe in each group who can put your comments onto the board if you put your things that you would like to say within the Zoom chat. Jenny, is there anything else you'd like to say on Miro there?
I don't think so. Just that if you ask questions, basically, your facilitator and your scribe are there to help you and to help guide you through this workshop. So no question is a stupid question. Ask them away. You can also use the Q&A function still while we're in here if you want to ask a question that the whole group can see. But I can't see any in there at the minute. And also there's also still the group chat that you can see as well. But thank you, Rachel, for taking us through that. And like I say, hopefully everybody will be able to enjoy the group work with their facilitator. Like I say, if you can, put your microphone on, put your camera on, tell people where you're from, what your background is, and then it will make the group work more enjoyable. So I am now going to open the breakout rooms. And I am going to allow everybody to self-select which room that they want to go into. Like I say, just a reminder, I know a lot of people are interested in community health, but we really want the other rooms to be full and engaged. So if you have that secondary interest, please go into the secondary room. I can see, I think, let me just assign Pablo. The language. Okay, so we have a facilitator in each room, we have a scribe in each room. If you lose connection, because we know some people connection is less stable, just rejoin the main webinar and we will put you back in the room that you were in, or you can self-select the room that you were back in again. So just try and remember where you are. So I'm going to open all the rooms now and you can self-select. So there's 2 community health options. There's livestock and companion animals, environment, food chain, or language. And if one of our rooms has got less people in, I might just pick a few to come into there. So that's why if you get selected, then hope that's okay. Hi, everybody. Welcome back to the main room, and thank you for joining in with the sessions. We really appreciate you asking questions, engaging, and thinking about what it means to educate for behavior change. So now we're just going to have a little bit of feedback from facilitators. I really want to impress on the facilitators that it's really just like a short summary, sort of 1 or 2 thoughts from each of the tasks, or if you had like an overarching theme or something really important you wanted to share back, then you can share that back. But we have 6 rooms and about 15 minutes to get through. So yes, just a couple of key thoughts that you've got from your session would be really great to hear. So I'm going to go to Mbali first because I remember that she's a facilitator. If you can unmute yourself and turn your camera on while I just find the list, that would be
No
great.
problem. Hi, everyone. Our topic was community health, and one of the highlighting themes when it came to the behavioral changes was people using them responsibly. So most people voted for that we want to push for people to use the antibiotics responsibly. And then in terms of like what easy actions people can do, we saw that just access to that information was very, very important. And also to ask questions when it comes to healthcare providers, practitioners, if this is really needed and how can I use it, just create that culture of being able to ask questions and accessing that information, anywhere from community events and so forth. What I loved about the barriers that some people mentioned, what stood up for me was the cultural beliefs. So we get a sense that most people seek advices from other sources and have maybe different ways of treating maybe infections and so forth. So that might be some of the barriers in terms of assisting people when it comes to the utilizations of these antibiotics. So it really stood up, and we just got the team to share a bit more. And one person also shared that how antibiotics are easily accessible, and there's no regulation in how pharmacists can prescribe them. So just bring money, paying up, and then people can get them. So like, okay, guys, and what I loved about this whole task was the messages. We got some really interesting messages, and one that I would like to share is don't beef with bacteria, use antibiotics wisely. I think that really stood up for us. And it was, and stop superbugs before they stop us. So the team really got creative. I think that's where we wasted most of our time. And yeah, and then so we thought about a lot of things in terms of the incentive, like if you finish your antibiotic, maybe bring the bottle or the package back to the pharmacy or so forth, and maybe you can receive a discount. So people got creative in terms of the different ways we can and push people to do it, and maybe it could really, really help. And then how can we push for it to become a social norm, so that maybe sharing it on TikToks where people share their stories or share how they use it, and maybe push for pharmacists in countries like Ethiopia to maybe only accept prescriptions. We talk as if it's a norm for prescriptions for people to use prescriptions, but in some countries they aren't. So maybe we can push for that, for it to become a norm. Always have your prescription, and let the community discuss regarding AML. So it was very, very interesting, a whole round of talking points from the team. And yeah, that's it. Thank you. Hope I wasn't too fast.
No, that was perfect. Thanks so much, Mbali. And really like some of the ideas that you mentioned there, especially the taking back the packet so that you get a discount next time. That sounds like a very implementable thing that people would like and appreciate, I think. Okay, amazing. Thank you for kicking us off with the first community health session. So now I'm going to go to Karina. Karina is another one of our facilitators. If you can unmute and turn your camera on, that would be great.
Yeah, hi everybody. So our topic was on livestock and companion animals. So pretty much for the first task, when it is we looked at behavioral changes, some of the things that kind of stood out was overall the education and the training for, your farmers, your pet owners, and communicating like any potential risks that can come with the misuse of antimicrobials. And one of the things that I also really liked was proper waste management to have as a behavioral change, because we do see that a lot of farmers, especially, we don't have proper waste management, they use antimicrobials, then that just gets into your water systems. And we have this cycle of antimicrobials just getting into places it shouldn't. So that's another thing that we saw persons should adapt to now having, as well as improved diagnostics and the alternatives for treatments other than antimicrobials. So rather than going to treat blindly, at least, delve into some diagnostics. When it is we came to the actions and also some of the barriers that we may have, some of the actions that the audiences can take to achieve the change is to have, routine vet care and consultations, as well as strong veterinary regulations for drugs, because we do realize that, you can't just get access to certain drugs. Persons will use it as they think may be best, but without that guidance from veterinarians and proper regulations, we defeat the whole purpose of trying to regulate and control how we use antimicrobials. Also, some of the barriers that we may have would be access to basic veterinary care and diagnostics, because as much as we may want it, persons may not actually be able to have that. There may not be a vet available that is nearby to them. Also, finances is always a big part. So they may have access to it, but they can't afford it. Diagnostics are sometimes really expensive depending on what it is. Also access to approved and regulated drugs, because as you know, depending on where you are, there's sometimes not many options for drugs. So persons tend to, try to use what they have, and then that just, creates a bigger problem, unfortunately. For task 3, how can we make it attractive? Of course, we were thinking that, yes, we have the use of social media. How can we use it to the best of our abilities? We can share success stories being from your veterinarians, your community, as well as the countries, to share their different practices, what has been working for them, showing that they have been maintaining good animal health without the use of antimicrobials, because we have other options for treatments and all of that. So, just the promotion of that also. If it is that we have certain persons promoting these success stories, persons or other persons may be more inclined. One of the incentives that I really did like was the support for farmers who adopt to, that proper biosecurity and preventive measures. Support for them that can be in the form of discounted veterinary care, as well as even feed. I do know there are some places that, already kind of does something like that. So all of this may be a better incentive for them. Definitely you want fewer unnecessary vet visits, so that helps as well to lower costs. Now, when it comes to making it a social norm, one of the things that really did stood out for me in particular was to make it visible and use social proof and peer understanding, not pressure. So I think that's really important to have a better understanding as to why your peers might be doing something rather than just doing it because somebody else is doing it. For it to become a social norm, we want to engage with our farmers, we want to engage with our pet owners, but of course, all of that comes with ease of communication and the access to certain information that we want them to have. As well as any policies, briefs that can be done, and institutional backing, because of course, once it is that we have, our leaders showing support for this type of initiative, it then creates a ripple effect. So these were some of the feedback that we had from our group. Thank you.
Amazing. Thank you so much, Karina. And thank you for leading on that group, especially because it was a combined one as a surprise. So that's great. Okay, I think Ohemu, I think his computer's gone off, so I'm gonna go to Michael.
No, Jenny,
Just
I'm
give us.
here.
Oh, Ohemu, you there? Okay, great. Please go ahead. Thanks.
Yeah, hi, everyone. My name is Godwin Pius Ohemu. I'm happy to be on a call with you guys. I'm sorry I can't turn on my camera. It's just 30 minutes past 4 a.m. here in the US, and you don't want to see my face very, very early in the morning. It's okay. So we had a very nice conversation. Our talk was around community health, tax 1, tax 2, 3, 4. Everything was nice. But what caught my mind that I would love to share with the team is the feedback that we got from the tax 3 and tax 4. So for tax 3, how can we make it innovative? How can we make our community engagement initiative very attractive? In terms of message and in terms of incentive. So my colleagues actually brought lots of wonderful ideas to the fore. First off, one of them, who happened to be a medical doctor, said, oftentimes in the clinic where he works, when people come for medical attention, they actually wait behind for something called triage. And he's of the view that during that wait period for triage, it could be a very nice time for a healthcare worker to take up the stage and engage the waiting audience in ideal focused conversation that borders around prudent use of antibiotics, how to follow your course from start to finish, and all of that. So we noted that as a very nice point. And then we also look at how to create cartoon images to convey the message of prudent use of antibiotics. Also handouts, for participants to take home. That could actually be a kind of incentive. Then storytelling. And then for incentive, we looked at the fact that maybe if you talk to the audience about hand washing as a strategy to prevent the spread of infectious diseases, it would be good as incentive for you to also give them something like liquid soap on their way back home and all of that. And then maybe giving them a printed shirt, a printed t-shirt that has information about prudent use of antibiotics on it. All of these things can go a long way in helping pass the message or to spread the message and to make it very, very attractive as well. Then on point 4, tax 4, sorry, how could it become a social norm? This is where we had a very robust conversation as participants brought wonderful ideas to the fore. First off, somebody suggested that we could get religious and cultural leaders on board. In the conversation of AMR, more often than not, these leaders of local communities are left out. And if we really want to make the ideals a social norm, we need to get these persons on board. Pastors, imams, and the kings and the obas of local communities. We can get them on board as, as vanguards, as advocates for drug-resistant bacteria infections or for the prudent use of antibiotics in different settings. Then also talked about the fact that doctor's prescription needs to become a core to getting antibiotics. Like, you cannot just walk into any pharmacy and request for antibiotics anymore. It should become a norm. It should become a requisite, okay, for everybody. If you want to get antibiotics, where is your doctor's prescription? That could actually make this idea of us a norm in the society. And then we could have reward certificate for pharmacies that comply with this idea. Probably if we have pharmacy A that adheres to making sure that all antibiotics sold in their fame were sold based on doctor's prescription. They could have a very nice certificate that they can affix to their wall, and this could actually go a long way in in encouraging them, to adhere to selling or disposing antibiotics to individuals that actually came through doctor's prescription. Then finally, we talked about have seminars. Seminars can be organized, and physicians with outlet centers and prescribers can come together in the sense that they can share knowledge together and work hand in hand, because the subject matter of antimicrobial resistance or prudent use of antibiotics is something that is multifaceted, is something that is interdisciplinary, interprofessional, and even multidisciplinary. And all of these healthcare workers must take it up as a collective responsibility to help the world win the fight against AMR. So these are the points that we noted in our group, where we had conversation around community health and all of that. So a bunch of thanks to Rachel, who was our scribe. She did a wonderful work. And if you have a look at our mural board, you get to see all of the points that she noted down. So thank you, everyone. And I look forward to pushing this idea forward with us.
Thank you so much, Goodwin. And thank you to Rachel and all the other scribes as well who have helped get the message down. So I'll go to Michael now, and then Pablo, and then Rishi. So Michael, if you want to feedback, that would be great.
Thank you very much. So hi everyone, once again. For us, our group was discussing on food chain, and we came about lots of topics, but we chose on break AMR food chain, and we discussed on the simple steps to take in curbing AMR in relation to food chain. And what was highlighted mostly was regarding vaccination, whereby once we vaccinate our animals, then it's easy to break the chain on AMR. But again, it was highlighted on issues of biosafety and biosecurity. So once we isolate these animals, especially those are sick, with proper mitigation, then it's easy to break the AMR chain in food supply. So the discussion was around the farm hygiene and the proper use of pesticides, and the barrier that was highly discussed during all the steps. It was regarding the willingness and again the price of these vaccines and biosafety and biosecurity measures in some settings. It's quite high. But when it came to on how we can make this campaign more attractive in regard to messages, the messages focused more on positive behavioral changes, whereby we don't want to threaten people, but we need them to understand clearly what we intend in curbing AMR. So focus more on positive behaviors, but again, making the messages in relation to our contextual language, local context language. So it's easy once we use the common language or the local context language of the individuals, it's easy to adopt and take the message seriously and then imply that and adopt them in their behavioral change. Again, how the incentives regarding how we can make it attractive. The incentives we discussed about the use of influencers, such as comedians, actors. It's very, very easy for these people because they have lots of followers and people engage with them. So it's easy to adopt the message and making it attractive in a funny way, but again, educating them. But one thing that we discussed regarding the incentive is ownership, which is very, very practical. And most of the projects maybe tend to ignore, but ownership is very critical in the sense that once we create the campaigns, the messages, again, it's very important to come on table and discuss with people what you intend to achieve, not setting your ambitions in office and then you go to the community and say, hey, use these messages. I think they're very nice to behavioral changes, but rather bring them on table and discuss on the practical and feasible measures that they can adopt. Again, supporting materials such as hygiene tools and other materials that are relevant on the campaign. And just to close the discussion on how we can make it a social norm, it's again sustainability through ownership. We sing the song about ownership in the sense that we need people to take self-reliance even at the end of the project so that they can adopt their behaviors. But again, ensure that the project or the campaign is inclusive, whereby we take on board both professionals and non-professionals in that context. Again, because we are talking about food supply, we also talked about taking individuals from the small scale to large scale farmers and producers. So the discussion was based on that, and thank you very much.
Thank you so much, Michael. Thanks for leading the discussion there. Food chain is a very interesting one because it has some crossovers between the different sort of One Health sections. So thank you for bringing that to life for us. So I will go to Pablo now.
Yes, hello everyone. Sorry. My team was focused on the language side. So first of all, big thank you also to the team and Lise for supporting on taking the notes. So participants highlighted the importance of peer-to-peer conversations, everyday relatable language, storytelling, and the metaphors used around AMR language, but also the visuals and the creativity like music or art that also came through strongly tools to make AMR real and memorable. So on easy actions, people suggested talking about simple steps like hand washing, asking doctors clear questions regarding antimicrobial use, but also sharing information with their friends or family and using accessible IEC materials. On the key barriers, we also identified to include jargon, heavy expert language, but also the lack of access to education and healthcare as one of the main barriers, as well as the cultural norm like sharing antibiotics and weak availability of engaging spoke people. Then to make it more attractive from the language perspective, the group also proposed using different approaches such as, for example, music challenges, TikTok, or even poetry, but also to bring more human histories rather than only facts. So putting a face into AMR. Incentives like competitions, recognitions, and community champions could also help. And the emphasis was on making AMR cool and culturally relevant. And finally, to make it social and more attractive, participants suggested creating visible role models. So for example, amplifying human interest stories, but also countering misinformation and involving content creators. There was also a call for more consistent, widespread messaging, peer accountability, and recognition of AMR in health records and that certificates to show the seriousness of the issues. So overall, the group energy was really high, especially bringing different cultural perspectives, the limitations that many times language can have when we talk about AMR, and also how important it is to keep communications clear, relatable, and social, turning everyday conversations into the driver of behavioral change. Thank you.
Amazing. Thank you so much, Pablo. Again, a really interesting one because it cuts through all of the different aspects of behavior change. But yeah, really sounds like you had a great discussion and thank you for that. So now we have our final facilitator feedback from Rishi. Thanks, Rishi.
Thank you, Jenny. First of all, thank you, Louis, for helping me conduct that session. We had a diversity of voices in that, but we chose to focus on one or two main strands of thought. We started actually with figuring out what are the main environmental determinants of AMR and finding out the hotspots, and we looked at pharmaceutical runoff and disposal, inadequate disposal mechanisms, and took that up as what we wanted to focus more on. So it's the disposal not just of human and animal waste, but mostly of medical waste, including unused antibiotics, unused antibiotics both for humans and for animals. The idea that we had for the behavioral change was instituting collection centers and returning centers. So any kind of antibiotic waste which is not used to be not thrown off randomly into streams that can contaminate environment, but to streamline and systematize this process of returning the antibiotics to a place which can ensure a safe disposal mechanism. What would make it easy, we thought, was to partner with pharmaceutical companies which make a lot of these antibiotics. They can be asked to incorporate these into the CSR mechanisms, but also collaborating with the local pharmacies or the drug shops to have collection centers and return centers where people could go back and just put the unused antibiotics there. To make them attractive, one side of things was messaging, to have, like some others have also said, consistent messaging and attractive messaging with social media efforts as well. But incentives here can be either, if you go to a drugstore to return unused antibiotics, you can get a discount, like a small discount on your next purchase, or this can also be other kinds of rewards that the group spoke about. And finally, about social norms and how to make them how to make disposal or safe disposal of antibiotics and ensure that pharmaceutical runoff does not go into the environment, was choosing AMR ambassadors in the community. So they can be either influencers or community role models, or local celebrities and leaders who take it upon themselves to kind of show best practices for the rest of the community and to streamline the message in a way that others want to be a part of that effort.
Amazing. Thank you so much, Rishi. And environment, again, like I know I've already said it, but language and environment are really two interesting ones for me because they're sort of different to the cohort 1 and cohort 2 winners. So great that you had such a good discussion, and hopefully some really great ideas have come from that for the people who were in the team. So a huge thank you to all of our facilitators and to all of the scribes as well, who helped organize and pull together the different discussions that you've had. What we really hope that you got out of this is some ideas, a bit of knowledge about campaigning for behavior change and how you can bring that to life for different communities in different ways, covering different topics. We'll share, obviously, the recording of this and the information from the Miro board so that you can have a look at that in your own time. But now I'm going to move us on. If you have any questions, then drop them into the Q&A function now. I'm going to run through a few more slides while you do that, and then we can broach the questions at the end of the session. So if you have any questions about any of the discussions that we've already had today, then please use the Q&A function to let us know what they are. In the meantime, I'm just going to go over the competition outline. So we're going to launch the competition this afternoon. So this is just sort of a breakdown of what we hope or how the competition will run. So from the learnings that you've had today, from the learnings that you have already in your own experience at home, from your own country, your own region, and your own organization, you can choose any of the categories that we've discussed today and bring it to life through your lens. Like, so what it means to you, what's appropriate for your community. Put all of that planning into an application form. The application forms will close on Tuesday, the 30th of September. So you've got quite a bit of time to get it done. And then we will have a team of judges who will work with us to select the winners, and the winners will be announced in the autumn. And we don't like to give an exact date just because it takes different amount of time to contract people and check some organizational things and everything. So, but we hope to early in the end of this year, then we'll be able to tell you who the winners are. And then Trinity Challenge, along with some of our partners, will really help you to go into the detail of your campaign and bring the campaign to life. And we'll hold an online event for winners, so you get to meet the other winning teams. We'll have 7 winning teams, and the campaigns will need to be delivered in 6 months. So these, we know that when you registered, you selected your region. These are the regions that we have as defined by the World Bank. We're really, really, really keen to get as widespread as possible. So we'd love to have one in each region, but if that's not possible, then as many regions represented as we can. Like I said, there's 7 pots of money, all of them for £7,500. So that's what you can bid for. We need 3 or more of your team to be in the age group of 18 to 35, and the team lead also needs to be 18 to 35. And your organization needs to be associated with another legal organization. So, for example, if you're a student group, you will need your university to be the responsible contracting entity. So they're the ones who'll sign all the contracts and stuff. That organization needs to have a bank account in its name. It can't be a bank account in a personal name. But you can see the full eligibility criteria on our website, and somebody might be able to drop that into the chat as we go through. This is the evaluation criteria that we're looking at. So we want you to be innovative. You know, we've already had WASH in schools, and we've already had biosecurity and animal health. So really try and think of a new angle, something different, something exciting. What's the impact that it's going to have? Obviously, we're looking at behavior change today. So measuring the impact of what you're doing is really important as part of the application process. The feasibility of it. So is it practical? Is it sustainable? We want you to work with other organizations. So which experts will you bring in? Which young people will you bring in? Will you be working with schools, or will you be working with WHO or whoever it might be that you want to have some level of co-design with? And then we'll be looking obviously at how you pitch your idea and the presentation and the professionalism of it. We have a competition Q&A webinar on Thursday, the 18th of September. So if you want to go away today, think of an idea, look at the application form, and then come back to this webinar with questions about what comes next, then we'd love to host you at that. And you can find the booking link on our website on the events page to join us at that webinar. And then we would also just really like to ask you if you could complete the survey after this. So you'll be sent a survey through Zoom, and we would love you to answer some of the questions there, just to let us know what you thought of the event and if it was useful for you. So these are our social media handles, and you can follow us. We've got lots of exciting things going on at the minute. Hopefully you'll have all seen our youth impact video, which really just celebrated the first cohort of winners and introduced the second cohort of winners. And we do hope to update that with the next when the next projects are finished as well. I'm just going to ask Hamish if there's any questions that I've missed in the question section.
Yes, Jenny, if you could just speak to whether a legally registered organization itself can apply, or whether the teams have to be separate from that legal entity.
Oh, right. No, any organization can apply. So if you're a big organization that already works in AMR and you're established and you've got your own bank account, a team within that organization can absolutely apply. They don't have to be separate. But if you are separate, you will need an organisation that can sort of sponsor you through this process.
Thanks, Jenny. And I believe Louise is currently typing a response to another question that came in. So I think we've covered everything thus far. But as dropped into the chat, just to note, we'll be publishing the full criteria on the Youth Voice page when it goes live. It'll be there from tomorrow morning.
Fantastic. Okay, great. So I think I've gone a little bit over time, so I'm very sorry about that, but we really wanted to hear back from the facilitators and make sure that we captured some of the conversations that you have in. We want to say thank you for coming and thank you for engaging with this project and being involved in the wider Trinity Challenge network. It's really something we're incredibly proud of doing, and we really believe in this project and really value the impact and the influence that young people can have all around the world on such an important global health topic that is really going to impact you and your lives, as well as old people like me who in 1 week will have aged out of the 18 to 35-year-old category. But thank you again to our partners at Black Sands, to our facilitators, and to our scribes. If you have a friend who missed this session, please let them know that there's another one that's the same this afternoon, that they're more than welcome to attend. And any questions that you might have, you can always email us at info@the Trinity Challenge if you have any questions that aren't answered on the website or in this webinar. And we look forward to seeing you all at the webinar next week on the 18th. So thank you very much, and have a lovely day or evening wherever you are in the world. Thanks so much.